I'm Dr. Anna Cronke with CLEAR, and I'm here to give you short tips on how to use CADE. Today's short tip is, where do I start first? Well, let's have a look at the assessment summary here for Patrick, an 8-year-old boy. I'm acting as Patrick's mom. I've completed CADE, and this is what I have. A moderate level of concern and a lot of areas to work on. Where do I start? Well, if you scroll down in the summary area of your CADE profile, you will see that there are flags numbering some of the symptoms. These flags can be helpful because they're indicating for you areas that might be causing your family and your child the most frustration and challenge. So if you don't have a specific area that you're thinking, gosh, I've got to tackle this, then you can use our flags to help you think about how to get started. Each flag with a number 1, like shift and flexibility or joint attention, is intended to be something that really helps a child be successful. And it should be one of your initial goals in therapy to work on areas like this. Number 2s indicate next areas of focus. So here, internally focused is a number 2, meaning that that could also be a good area to target intervention. Repetitive behavior also gets a number 2 on this profile. Toilet training and functional communication are number 1s because when we can do basic things for ourselves around the house and in the community, we have more space and room to work on other more challenging things like joint attention, something that's a little more higher level with our thinking and reasoning skills. Now, toilet training is really hard, but once you get that mastered, it opens up a lot of doors and support. So if we think about toilet training, you have a child who's not mastered that yet, we know from our recommendation that ABA therapy or occupational therapy could be most helpful. That's an area you really want to start. Functional communication is similar because if we can't communicate what's going on, it's very limiting. And you'll see that's also something that an ABA therapist might work on. So when you're delineating targets from these recommendations, ABA therapy to work on some of these areas might be your first go. You can see that disordered eating is a number 2 flag. Again, when we have a really limited diet, that can be very hard for a family. And social awkwardness gets a 1 because we want to teach those basic social skills that can help kids engage and feel welcome and happy and supported within their school community or their neighborhood community. So that makes that a primary target as well. You can see there's a number of things in this profile that we've indicated that Patrick needs to work on. But if you look at the targeted areas and pick a couple that are really bothering your family, then you know where to start. Thanks so much for watching this tip from CLEAR.